my encouragement to our people, they should be patient and they should run it through a process.
No local remedy validated for the cure of coronavirus will be ignored. Presidential Task Force on COVID-19 assures Nigerians as search for solutions to the ravaging scourge intensifies.
Urge the Northern Governors Forum to provide their Almajiris with the requisite tools.
Representatives caution on evacuation of Almajiris to states of origin to mitigate spread of COVID-19. Nursing the world to health in a pandemic in focus as International Day of Nurses is observed.
We are now ready to put the 30 megawatt Gurara hydropower plant into sustainable operation.
Plus, Gurara multi-purpose dam set to deliver 30 megawatts of hydropower as federal government seals deal. Welcome to the Network News on the NTA. I'm Ian Ray John. Reading with me tonight are Hingino John Adams in Lagos and Mina Ukwabasi from Enugu. The news in just a moment. Now, let's start with an update on the coronavirus pandemic across the world as the number of infection rises in Russia, making the European country the second with highest number of coronavirus infections globally. Over now to Joyce Ometu for details.
In Nigeria, the total tally of confirmed COVID-19 cases has risen to 4,641, with 150 fatalities, as 242 new infections were announced on Monday by the Nigeria Center for Disease Control. Southwestern Nigeria records the highest number of cases in the country, with Lagos State topping the charts in that region with 1,933 infections, while the northwestern region is a rising hotspot as Kano records 666 infections, the highest in the region. North Central Nigeria has the third highest number, with the Federal Capital Territory following with 359 cases. In the northeastern region, Borno State tops the ladder with 230 infections. The southeast has the least number of COVID-19 cases in the country. As at 6 p.m. 12th of May 2020, the Africa Center for Disease Control reported 66,373 cases of COVID-19 in Africa, 2,336 deaths and 23,095 recoveries. The World Health Organization Director General Tedros Ghebreyesus said there are about 7 to 8 top candidate vaccines for COVID-19, but more funds are required to accelerate the development. Globally, numbers published by Worldometer as at 6 p.m. show 4,292,506 infections, 288,975 deaths, and over 1.5 million recoveries. Russia now has the second highest number of confirmed coronavirus cases worldwide after the United States. On Tuesday, it reported 10,899 infections, bringing the total to more than 232,000. And that's a global update on COVID-19. Many thanks for watching. I am Joyce Ometu.
Many thanks, Joyce. And back home, more patients are recovering from COVID-19 across the states. Reports from Sokoto say about 22 more COVID-19 patients have been discharged, bringing the number of discharged cases to 41. Chairman of the State Task Force on COVID-19, Dr. Mohammed Ali Name, revealed this in Sokoto. In Jigawa State, 7 COVID-19 patients have also been discharged after testing negative twice. Meanwhile, the state government now allows Jumat prayers with strict observance of physical distancing and use of face masks. Report from Ondo State says 5 COVID-19 patients have been successfully treated and discharged from the state infectious diseases hospital in Akure. The State Commissioner for Health, Dr. Wahab Adegbenro, announced this after the patients were discharged. The Presidential Task Force on COVID-19 says no local remedy for coronavirus will be overlooked as long as it is presented before the health authorities for verification and validation. Chairman of the task force, Boss Mustafa, stated this at the daily briefing in Abuja. Mitari Ikbem brings us details.
The presidential approval for Nigeria's health authorities to subject the Madagascar COVID-19 herbal remedy to scrutiny is still generating mixed reactions.
Most of the
PTF chairman at this briefing reiterated that Nigerians with homegrown remedies for COVID-19 should approach the relevant health authorities for validation of their claims, rather than circulate such claims solely on social media.
My encouragement to our people, our researchers, and those that are involved in the processes of manufacturing drugs, especially our homegrown cure, they should be patient and they should run it through a process. And that is the only way we can have it validated. The question was to see if subsidy can be put in place. I think the Honorable Minister of Health would look at all these things, because we are so much in a hurry to obtain a homegrown cure.
As stated by NAFDAC, no drug and related product can be manufactured, imported, exported, advertised, sold, or distributed in the country unless legally registered. So this drug will go through the normal expected process, which will be quite stringent before it can be administered.
As community transmission of coronavirus continues, the task force warned against unhealthy practices and disregard of its COVID-19 safety guidelines.
The Presidential Task Force has become aware of the ongoing practice of sharing masks and picking of masks for recycling from dump sites. This places a lot of responsibilities on all of us to be self-educated and to educate others.
The Minister of Health gave clarification on why the suspected index case in Benue State is still in isolation.
I called her on phone and persuaded her to just let them take the test. She gave me the condition that first they must give her all her results from the past. They took all her results, photocopied all of them, and gave them to her. But on the day of the test, when NCDC got there, she told them that she wanted the test to be taken by World Health Organization.
There were also updates on the school feeding program and activities of environmental health workers.
We are targeting these homes where these school children come from. We are giving this voucher to these households that are being identified.
We run 3 shifts of 8 hours, and we have 2 environmental health officers per shift, making a total of 6 at land borders.
State governments and security agencies were urged to intensify surveillance against interstate movements towards curbing community transmission of coronavirus. In Abuja, Mitari Ikben, NTA News.
Away from the task force daily briefing now, that this day dome situated at the Central Business District of the FCT has been formally handed over to the Federal Ministry of Health and the Federal Capital Territory Administration to support government in containing the coronavirus pandemic. Elizabeth Omori reports that the testing, tracing and treatment facility is supported by the private sector coalition against COVID-19, COVID and the Sahara Group.
This dome used to be an event center, but with Nigeria's current situation, battling a pandemic that is claiming lives, today the dome is now an isolation center for the containment of COVID-19. The more than 300-bed facility also has intensive care units with ventilators, X-ray and dialysis machines, as well as a 54-gene testing mobile lab with a scalable 200 to 1,000 tests per day.
We have the tracing app, which has been developed by our technology team, who have put this tracing app together. So when you are tested, we can trace all your contacts with this app.
I want to thank my own partners, NMPC, who funded this and financed this. I want to thank the CBN governor, who kept on saying, whatever you guys need, we're behind you.
With such gestures and commitment by the private sector coalition against COVID-19, members of the Executive Council and Presidential Task Force on COVID-19 are optimistic that the global pandemic will soon be a thing of the past.
The Presidential Task Force advocates strongly that lessons to be drawn from COVID-19 should therefore revolve around development, future planning, consensus building, collaboration, and partnerships.
This facility was built to the highest quality standards of infectious disease protocols by well-experienced hands.
The Central Bank of Nigeria is developing a framework under which grants and long-term facilities will be provided to researchers to develop Nigerians' homegrown vaccines.
We thank all those who have supported us and also continue to appeal for more support so that by the grace of God, give another few weeks, we'll be done with this COVID-19.
Another structure with 98 rooms in a conference center has also been made available to medical staff in Abuja. Elizabeth Omori, NT News.
Heading to the National Assembly now, the House of Representatives Tuesday considered and adopted several motions bordering on interventions to mitigate the social and economic impact of coronavirus pandemic. National Assembly correspondent Lamia Ali reports that issues of evacuation, alternative medicine and provision of testing centers took center stage.
House members there as plenary applauding frontliners as the world marks International Day of Nurses amid the coronavirus pandemic. Plenary commenced with matters of urgent public importance on COVID-19, among them an urgent need to look into the evacuation of Almajiris in view of health and legal implications, during which the House called on the Presidential Task Force to immediately halt the evacuation by enforcing the interstate travel ban as moved by Representative Aisha Duku.
In some cases, these children, after traveling for so many hours under harsh weather, were rejected and turned back by their states of origin, or at best, they were kept in isolation under dehumanizing and demeaning conditions.
All the Northern Governors Forum to provide the Almajiris with the requisite tools for the universal basic and technical education system.
Representative Osi Prestige in a motion called for support to the use of alternative medicine for the treatment of COVID-19, while Representative Hassan Falata made a plea to authorities to establish a testing center in Jigawa State to help arrest the spike of COVID-19 in the state.
To encourage and support some of the claims by our local scientists and alternative medical practitioners, as some of their claims sounds convincing enough to hazard a trial of the drugs developed by them.
Aware that Jigawa State has no single testing center and most of the hospitals and health institutions are not equipped adequately in terms of facilities, drugs and personnel.
Other issues considered and adopted by the House pertaining COVID-19 are the point of order from Representative Umar Jiga, urging the federal government to take measures of mitigating the impact of the pandemic on internally displaced persons across the country, while Representative Chudi Moma requested a review and investigation of the power sector during the pandemic. House Leader Adodogwa led debates on 4 motions, all of which passed second reading. A bill seeking alteration of the Constitution to allow for independent candidacy to any elective office, sponsored by House Chief Whip Mohammed Tahir Mangunu, passed second reading.
The general perception that political parties are hijacked by few group of people. A professional that feels is popular with the grassroots, with his people, can get signatures and become a candidate. Why not?
All our attempts to strengthen and deepen democracy, as far as I'm concerned, this is about the first approach.
Plenary also featured the consideration and adoption of the presidential request on its borrowing plan of 800 50 billion naira. From the National Assembly, Lami Ali, NTA News.
In other news, some of Nigeria's diplomatic missions abroad are without ambassadors. In order to close this gap, President Muhammadu Buhari has written the Senate requesting the confirmation of 42 persons as career ambassadors designate. National Assembly correspondent Ignatius Nkwo reports that the president also sought approval for 4 nominees as chairman and members of the Nigerian Law Reform Commission and 2 nominees as board members of the Nigerian Deposit Insurance Corporation.
The week's plenary took off on an early start with President of the Senate Ahmed Lawan reading President Muhammadu Buhari's request for confirmation of appointment, of which 42 are ambassadors designate.
It is my hope that this request will receive the usual expeditious consideration of the Senate. In most of the countries, Nigeria should have ambassadors. There are no ambassadors at the moment, and is taking toll on us.
Mr. President also sent in 4 names as replacement for Delta, Ebonyi, Lagos and Nasarawa states in the list earlier sent as nominees for Federal Character Commission. The bill that seeks to provide for the prevention, control and management of sickle cell anemia for a well-coordinated approach sponsored by Senator Sam Egu, and the one for the establishment of Advanced Healthcare Development Fund sponsored by Senator Sandy Ono passed second reading.
It will also empower the ministry to accredit reputable public and private hospitals to function as accredited participants in the prevention, control and management of the disease.
This will go down the ladder from the state to the local government to the community.
That this bill is an initiative that should come alive to address the gaps that we see in our current healthcare delivery system.
A motion by Senator Ike Ekweremadu emphasized the need to observe the presidential order banning interstate movement and for the Inspector General of Police to investigate alleged complicity by police officers. Senator Sani Musa's motion called on the federal government to take drastic measures to end banditry and kidnapping in Niger East Senatorial District of Niger State, while Senator Bello Mandia drew the attention of the Senate to the urgent need to also beef up security in Katsina State against banditry.
Urge the federal government to establish a permanent military base at the boundary between Alawa and Oregi, areas of Shiroro and Rafi local government respectively of Niger State,
and urge the federal government to immediately begin the implementation of the recommendations of the report of the Senate Ad Hoc Committee on Nigerian Security Challenges.
The Senate President has inaugurated ad hoc committee that will investigate alleged financial misappropriation in the Niger Delta Development Commission. Senate has adjourned plenary to 19th of May 2020. From the National Assembly, Ignatius Nkwo, NTA News.
Ahead in the news, nursing the world to health. Details after these messages. To stay.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
My mother-in-law and I are like 5 and 6. And our Gile game is copy and paste. But when it comes to our favorite milk, we're so different. My mother-in-law loves her pig-filled milk because it's low in cholesterol. And I love my pig full cream milk because it's rich and creamy. And that's why I buy both. So choose your pig today.
Pig. Reach for your pig. Okay, no problem.
COVID-19 is not easy on my business, so my client just put the project on hold. Imagine that one of last week. They cancelled it. And I am scheduled to call my tax officer next week. What do I tell him?
Relax. FIRS has it sorted already. That's why they issued palliative measures to cushion the effects of COVID-19 on taxpayers. Remittance of VAT, which used to be on or before 21st of every month, has now been extended to the last day of the month. FIRS also states that it's imperative that companies whose revenues are in foreign currency and personal income, tax returns for foreign affairs, non-residents, military and police, immediately check their website for important updates as well as information on late returns penalty. All supporting documents can be submitted later to the tax office for all those who cannot access email facilities. There are lots more. From now till further notice, FIRS says all taxpayers can now take advantage of its simple, user-friendly and robust e-filing process to submit their documents online instead of visiting tax offices. Dedicated email addresses for each of the offices are available on their website, www.firs.gov.ng. Stay safe and comply with all the guidelines issued by the government so that together we can make Nigeria working again.
This broadcast is powered by FIRS, Federal Inland Revenue Service.
Nigerians, let us take responsibility. Stay healthy, stay safe, and curb the spread of the virus. Take responsibility. The coronavirus spreads from one person to another. Let us avoid crowd gathering of any kind for any reason. Take responsibility. Avoid traveling from one state to another during these lockdown restrictions. Obey all the rules that are put in place. Take responsibility. Stop spreading fake news and unverified reports about the coronavirus. There is no known cure for COVID-19. Take responsibility. Observe all the measures that can help stop the spread of the virus. Together, we can do this, but only if we take responsibility. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
25th February 2020, Nigeria. It is real. It is a nightmare. It is killing people all over the world. It is COVID-19. Compliance with the various states in Nigeria, the current measures will flatten the curves. Shutting down is not an act of wickedness, but an act to save lives. Stay home, stay safe. Observe social distance. Always put on a face mask while leaving your house. Make sure you are on a tricycle alone. Cars and buses cannot carry more than half their passengers. Always remember to wash your hands. Together, we will defeat COVID-19. This message is brought to you by the National Orientation Agency, Nigerian Film Corporation, powering possibilities.
We have observed the lockdown. We have practiced the measures in order to curb the spread of the virus, but we can do better. The coronavirus spread is increasing daily, and only together can we cut down the numbers and defeat the spread of the virus. Remember, COVID-19 is not a death sentence, and a recovered patient cannot spread the disease. Do not stigmatize. Do not hesitate to report any case, or if you have come in contact with anybody that has been infected with COVID-19. If you have cough and fever, please stay at home and call your state hotline. Find state numbers at www.covid19.ncdc.gov.ng. Remember, it is for your own good and for the good of every Nigerian. Let us do better and defeat the virus. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Good to have you back. The federal government says it will continue to maximize the potential in the water, hydropower and irrigation sectors through effective public-private partnerships. One of such partnerships is now set to deliver 30 megawatts hydropower from the Gurara multi-purpose dam in Kaduna State. Musbao Dan Wahab reports.
Beyond supplying water to the lower Usuma Dam, which serves the FCT with potable water, Gurara Multi-Purpose Dam has had its other potentials on the lock since completion about a decade ago. Part of them is a stranded 30 megawatts of electricity meant to serve the industrial area of Kaduna State. Now, here is pen to paper, an agreement between the federal government and the concessionaire to finally unlock the hydropower potential of the dam.
We are now ready to put the 30 megawatt Gurara hydropower plant into sustainable operation towards increasing access to electricity in our country, especially in Kaduna State, for job creation and improved life for the people.
The power plant is ready, it's been completed. The transmission line also has been completed, but there is a small portion of the connection in Kaduna that needs to be tidied up, and that's why the minister has given a much order that this will be done as soon as possible to be able to release the 30 megawatts to the people.
And just like the story of Gurara, 40 megawatts of electricity from the Kashimbila Multi-Purpose Dam in Taraba State is part of other hydropower potentials still waiting to be tapped across Nigeria.
Dadinkowa is 40 megawatts of power. It's finished, it's a concession. It is the first on-grid power plant in the entire northeast of Nigeria. That shows you the power of public-private partnerships.
Apart from the flow of power, the federal government also stands to gain about 17.7 billion naira concession fee from these agreements. In Abuja, Musbao and Wahab, NC News.
And in health, as Nigeria joins the rest of the world to commemorate this year's International Day of Nurses, the focus is on the vital role played by nurses and midwives in the health sectors around the world. Correspondent Alika Okwanachi-Aruwa in this special report takes a look at the contributions of nurses in providing healthcare services.
One of the most significant aspects of this year's Nurses Day celebration is that the World Health Organization, WHO, not only declared the year 2020 as the year of nurses and midwives, but also that it is coming in the midst of the coronavirus pandemic, when the world needs the services of nurses the most. President, National Association of Nigerian Nurses and Midwives, Abdurrafiu Alani Adeniji, stated that a healthy nation is a wealthy nation, since the well-being of a nation is reflected in its national development. He emphasized the need to change the narrative about nursing, erase misconceptions, and expand the understanding of the public on the importance of nurses to any nation. Others maintain that despite the risk involved in being a nurse, particularly with COVID-19 raging, they do not regret going into the nursing profession.
My message to all nurses is to keep the fire burning. Do not change who you are. Continue to take care of the patients, which is our calling. And the most important thing that matters in nursing is to have the passion for what you do.
To my fellow nurses out there, I advise them to take the necessary precautions. Our PPE is very important. Just see every patient as a suspect.
Nurses are calling on the government to make their job easier by providing state-of-the-art facility in hospitals and protecting the lives of nurses, especially with the threat of COVID-19. In Abuja, Alika Okwanachi-Aruwa, NT News.